Focus on Health, your weekly dose of health and wealth information on KUTV.
Welcome to Focus on Health and thank you for joining us. My name is Barry Michelle. Now, sickle cell anemia is a group of inherited disorders. This results into the red blood cells contorting into a sickle shape, and this also causes shortage of the red blood cells and can also cause block of blood flow, which causes pain. Dr. NIMROD is going to be taking us through that, but even before we see Dr. on that, here now is a health update. That was the very informative health update, and today we're talking about sickle cell anemia with Dr. NIMROD. So Dr. maybe you can introduce yourself to our viewers before we head down to the topic of the day.
My name is Professor NIMROD MWANG'OMBE. I'm a neurosurgeon based at the Department of General Surgery, Kenyatta University Medical School. And my specialty, number one, I'm a physician. Secondly, I'm also a practicing registered general surgeon, and thirdly, I'm a practicing registered neurosurgeon. Sickle cell anemia is put under the category of diseases we call hemoglobinopathies. Now, these are conditions where there is an abnormality in the hemoglobin structure. And what happens in sickle cell anemia, the hemoglobin pattern of sickle cell, there is an area which we call the beta hemoglobin at position 6. The amino chain cells, amino acid glutamine is replaced by amino acid valine. Now that changes the composition of that hemoglobin structure, and it results in all the problems which we encounter in patients with sickle cell disease. We don't know why this happened. This was a mutation which has been traced to having happened many years ago, thousands of years ago in Africa. It is thought that probably this mutation is related to malaria, and it was one of the ways in which the body reacted to protect itself against malaria. And this is thought to be because patients who have got sickle cell disease and are carriers, they don't get the very severe type of malaria. While patients who have got sickle cell anemia, then they get the malaria, which eventually, of course, kills them. Thank you. There is really no particular cause for sickle cell, because as I've explained to you, it's a hemoglobinopathy. So because it's a hemoglobinopathy, there is an abnormality in the hemoglobin chain. And this abnormality leads to the red blood cells behaving in an abnormal pattern under certain situations. Do you understand? Now, some of the situations is, for example, infection. If there's an infection, then that red blood cells becomes abnormal and it becomes sickled. The shape it takes is that's why we call it sickle cell anemia, because it takes the shape of a sickle. Look at it. There are many factors which can precipitate it. One, as I've explained to you, is infection. Okay, any factor which can lead to low oxygen tension, low oxygen in the blood, can lead that red blood cells to sickle, and then cause a crisis. So, but this is an abnormality in the red blood cells from the hemoglobin, which the patient has inherited. The patient inherits it from the parents. The patient to inherit it, both parents must be carriers. So if both parents are carriers, one of their children may be born with sickle cell disease. In fact, if both parents are carriers, 50% of the children will also be carriers. And 25% of their children will have sickle cell disease. So only about 25% will escape. So in other words, this is you inherited it from your parents. And this brings in the very important point of prevention. Prevention, the only way you can prevent it is two people who are carriers, they should not conceive. because the chances of them giving birth to a child who will have sickle cell disease is 25%. Yeah. The signs and symptoms, within the first 3 months, 6 months, the child is usually quite okay. But after about 6 months, the child can start having the symptoms. And definitely by 1 year, 1.5 years, the child will start having the symptoms. And the symptoms are precipitated, as I've explained to you, by infections. For example, the child will have an infection, and by the infection, he'll get a crisis. And the most common symptoms is pain. Bone pain, abdominal pain, all those things are related to the crisis which may occur in that child. Now remember, these red blood cells, when they come together, they form clumps, they cause blockage of the vessels which are supplying specific areas. So supposing it is in the brain, they can cause a blockage of the area of the brain, and the patient can get a stroke. Supposing it's in the kidney, they can cause a blockage of those areas of the kidney, and the patient can get kidney damage. Supposing it is in the spleen, the same. So all these are related to the blockage of the vessels which are supplying end organs. And therefore, ultimately, the patient now starts getting failure of those end organs. Initially, it's pain, which puts this patient into a big problem. And we have to know how to manage the pain, severe pain. And the pain, again, is related to the blockage of the vessels by the clumps of the red blood cells which have clumped together. They block that area. And that pain is really what we call anoxic pain, because there is no blood supply there. So there is usually pain. And as I've said, damage to any of those areas then can result in presentation related to effects of that damage. What I've mentioned to you is malaria. If the patient is a sickle cell has a sickle cell disease, not a carrier, then malaria can precipitate those attacks. But also sometimes they can be immune to that malaria, severe malaria. But also any infection can present that attack. Okay, so that is one of the things. Now, of course, the other one which we have to also note is, supposing we are going to do surgery on that patient, we under the low oxygen tensions, when the patient is put under anesthesia, they may go into a crisis. So that those things can precipitate that. A patient can be dehydrated. So again, if a patient, for example, has not taken enough fluids, okay, and he's dehydrated, they can go into crisis. We call them a crisis. Okay, a crisis is the situation whereby the symptoms now manifest themselves. Because otherwise, sometimes the symptoms are not there, and we don't know why. Some patients, each patient behaves differently. One patient may have, let's say, 4 or 5 of those symptomatic crises per year. Another patient may have about 1 per year. But these crises are much more frequent when the patient is younger. But as they grow older, they become less. But then the end organ damage now starts bothering them. And as I've explained, what some of the problems is, the chest can also be infected, and the patient can go into pulmonary failure. Any area in the body can be affected by sickle cell disease. But these are crises precipitated by situations, as I've explained to you. One, the common ones are infection, dehydration is one also. They say also changes in temperature, very cold weather, very warm weather also can precipitate and bring about those crises. And when those crises appear, then the patient now goes into a situation where they have severe pain, all right? And if the damage has occurred in that area, then they get the symptoms related to that organ which has been damaged. Fine. Now, the complications which arise, as I've mentioned to you, in the early stages, the patient is having these. When they get this crisis, because of the blockage of the organs as a result of the blood vessels clumping together and blood cannot go inside there, then that damage can be seen. For example, patient can get hip problems, and you can get necrosis of the head of the femur, because of that. Okay, a patient can get infarcts into the brain, and even like a major stroke. Although that's not usual, they'll just get small changes which can occur. Patients can get what we call pulmonary hypertension. That is very high pressures in the pulmonary artery, which leads into respiratory distress, such that the patient gets problems of breathing adequately and all that. So all these the features can occur, and they present the patient to the doctor. Now the sad thing is that because the patients usually don't know that they have sickle cell disease, they end up being treated just for pain or for whatever they may be suspected. It's only if we do some tests, or if the tests were done at birth, and it is known that this child is a sickler, that is when now, when the child starts developing those symptoms, we can say that this is because of sickle cell disease, and then now we can manage adequately, to try and prevent those crises or lower them. So therefore, the sad bit is that because of these shortcomings, many of these children don't access medical care. And because most of these children are in the rural areas, as I've explained to you, where this condition is found, and quite a number of them do not live beyond the age of 5 years. Yeah.
We are going to take a slight commercial break, and when we come back, Dr. is going to be telling us more about the risk factors associated with sickle cell anemia. I will leave you with the Did You Know segment. You can also follow this conversation on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram, and we'll definitely get back to you. Do not move a muscle.
Focus on Health, your weekly dose of health and wealth information on KUTV.